Good day, everyone. I am Christine J. Furukawa, and now I will introduce you my research, which is the effect of contraceptive methods for men and women. So, introduction. In 1960s, rhythm and barrier contraceptives were the only methods of birth control widely available to couples desiring to plan the number of and spacing for their children. They called it family planning. Birth control is used to prevent pregnancy. It can be used by both men and women. Types of birth control can include pills and intrauterine devices, well known as IUD, vastu- vasectomy, and condoms. The various contraceptive methods have the health risks, but pregnancy itself has attendant risks of morbidity and mortality. In 1983, Ori et al. Attempted to quantify the mortality risk associated with using the various methods of contraception. Those risks were compared with the risks associated with using no method of contraception, which are actually the mortality risks associated with pregnancy. Most epidemiological and clinical studies of the health effects of contraceptive have been carried out in developed countries. We recognize the difficulty in generalizing this result for the special health and cultural situation in the less developed countries. Furthermore, the effects of the various contraceptive methods on the risk of diseases generally limited to less developed countries have had vary and contraceptive use in these countries. Studies to evaluate the health effect of contraceptive in various regions and cultures are needed. Modern contraceptive methods vary substantially in how effectively they prevent pregnancies. Because pregnancy itself has attendant health risks and benefits, the rates of accidental pregnancy associated with the various methods of contraception are one important aspect to consider when measuring the health effect of these methods. Method options need to be widened and counseling needs to be improved to ensure that women fully understand the issue of side effects and make informed choices about the contraception. So let's go to the body. Birth control is a way for men and women to prevent pregnancy. There are many different methods of birth control. By learning more about options, you can decide which method is right for you and your partner. If you are sexually active and you don't want a baby, don't wait to use birth control. An unintended pregnancy can happen anytime you have unprotected sex. Few years headlines announced that new male birth control is coming. Maybe it's a pill, a shoot, or some other contraceptive method, but they are rarely move on past clinical tests. Some blame the hold-up on men's health concerns. Others worry men wouldn't widely use contraception even if it was available because you are dealing with an otherwise healthy population that doesn't face the physical risk of pregnancy. This raises the standard of safety to a higher bar as well. Explained by Aaron Hamlin, the executive director of the Male Contraceptive Initiative. Those worries may be overstated. After all, women risk a similar litany of side effects, including migraines, blood clots, depression, and high blood pressure because of hormonal birth control. Women shoulder the majority of the burden of the family planning and have been doing so for 6 decades, plus nearly half of US men have reportedly they use the new birth control method if there was one. Currently, the only readily available male birth control option are the condoms. Abstinence of sterilization, condoms help prevent many sexually transmitted infections. On top of pregnancy, however, many men want more choices to take control of their reproductive future. Here are a few other male family planning options that have not yet come to the market. A vasectomy is a simple permanent sterilization procedure for men. The operation, usually done in physician office, requires cutting and sealing the vast different the tube in the male productive system that carry. Sperm. A vasectomy prevents the transport of sperm out of the testes. This surgery does not affect the man's ability to achieve orgasm or evacuate potency. There will still be a fluid ejaculate, but there will be no sperm in this fluid. Studies have shown that vasectomy increases sexual satisfaction between couples. Abstinence is the only birth control that is 100% effective and is also the best way to protect you against STDs. You may not be ready to have sex. Don't let someone pressure you into having sex if you don't really feel ready. It is an important decision with serious emotional and physical consequences. And now let's go to the conclusion. So lastly, both men and women can start most contraceptive methods at any time and few examination or tests, if any, are needed before starting a contraceptive method. Routine follow-up for both men and women includes assessment of his and her satisfaction with contraceptive method, concerns about method use, and changes in health status of medication that could affect medical eligibility to continue use of the method. Women changes in bleeding patterns are one of the major reasons for discontinuation of contraception. Recommendations are provided for the management of bleeding irregularities with various contraceptive methods. In addition, because women and healthcare providers can be confused about the procedure for mass pills and dosing errors with the contraceptive patch and ring, the instructions are streamlined for easier use. ESPs and emergency use for co-IUD are important options for women, and recommendation in using these methods as well as starting regular contraception after use of emergency contraception are provided. Male and women and couples who have completed childbearing, for men undergoing vasectomy and women undergoing hysteroscopic sterilization procedure. Additional contraceptive protection is needed until the success of procedure can be confirmed. That's be all. Thank you.